Any announcements from either the county executive or the chair?
Nothing for me.
Okay. So with that, we will go ahead and move forward with our agenda. The first thing on the agenda is the resolution for EMS special events. The main driver behind this was just there was some confusion on why certain people are charged for events and certain people are not. The goal of the resolution is to help clarify that. Willow, if you'd like to go ahead and address it.
Sure. So with the new resolution, one thing that the old resolution didn't account for and that we've run into over the last few years is events like the Sundrop Festival or the different festivals that happen throughout the county. Typically, if it's an event that's going to draw 500 people is kind of our number, our threshold, then the Office of Emergency Management does a threat assessment and we have that kind of as our trigger point to know that we need to staff a unit at that event. There's other events that people request coverage for, like not-for-profits or different fundraisers and things like that, that we charge for, but you know, from the outside looking in, there's kind of a discrepancy there of why are you providing one for free here and not here. So this really is just kind of to clarify that and to clarify the amounts and in an attempt to make the amounts appropriate to the service that we're providing.
Josh, would you care to touch on what exactly a threat assessment is and how you go about
Absolutely. So basically what we do is we look at the total number of people that potentially could be at that event versus the resources we have in the county. So 500 was that number that was kind of set a long time ago. Basically, if we have something and there's more than 500 people there and say someone decides to drive a car through, we don't have enough people to take care of everybody. So, at that point, we're looking at RMCC, we're calling a state in. So at that 500 point, that's where we really start pushing our security message, hardcore. We're looking at putting up barriers, we're looking at, staging EMRs around, command staff, so we're gonna be putting up communications. We're gonna have actively, people walk around with communications, if they see something, say something kind of thing.
And we also notify the state level too, so we notify the region and up to the state level that, hey, we have this event going on here in Giles County, so that if something does happen, they already know, and if we did have to call that regional communication center, they're like, oh yeah, Giles County, this event, they know already exactly where to send resources to.
So with like the Sundrop Festival, we hit that 10,000 mark. So TEMA actually sends us people in too. So not only do we have our local responders, but I have TEMA here that kind of can help run that communications line, and they can get us resources quicker, kind of thing. So it's like a bunch of steps and different levels to the response part of that. That's all it is.
Does this include ball games?
So what we've been doing is we send an on-duty unit to the ball games. We don't charge for that because it's a county entity. And that was something else that we tried to clarify within this updated resolution was stuff like that where, we provide that service, say, for the school system and other entities. We've done it for events that, the Sheriff's Department was covering an event and we had people there as well. And, we don't charge for that.
Prior to going through questions, would anybody like to make a motion to approve? Motion by Mr. Carpenter, second by Mr. Sutton. Okay, Gail, I know you had your hand up.
RCC, you mentioned RCC.
Sorry,
What's that?
the Regional Communication Center.
Oh, okay.
Yeah.
Ms. Bailey.
Yeah, I understand what they're saying, but the way the resolution is written, it seems to also take in private events. It does not include private events on private land. How is a person expected to know the number of attendees to their events? Is it all events open to the public, including political events? We're coming into a political year, so if Knox was to have an open house and invite the public in general, would that be included if it's on private property? Weddings, family reunions, pumpkin patches, employee picnics, funerals, estate auctions. What about short notice events from something in the news, like the vigil for Charlie Kirk? What about churches and events at UT Southern? I ask these questions because a lot of other counties that have things that aren't exactly like this, but they specifically exclude some of these things. It also doesn't make clear what time period the 500 people would be in. Is it 500 people over an hour, 2 hours? There's no time frame, a day, a weekend, 2 weeks. Common sense tells you what it should be, but it's not written into the resolution. What is the time frame for approval or notice? Can the threat assessor just wait until after the event would even take place to even do the threat assessment? Or does whoever does the threat assessment have to let you know within a specific time frame? That's not in the resolution. How are the threat assessment inspectors trained? Or is it only the people in the positions named in the resolution? What if they're on vacation or gone and you have a short notice event? What can mitigate a threat? What does the threat assessment consist of? He covered that a little bit, but will there be a written rubric or just a feeling? Do they come on private property uninvited to do their threat assessments? Can it be denied or deemed too dangerous for an event to take place? Are we going to outsource and pay people if there's 3 or 4 events happening in a weekend, if it covers the events mentioned earlier, like pumpkin patches? How does this affect our regular coverage in the county for individuals if we do have more than one event going on? So if someone's having a very large event, political thing, at the same time as a fair or festival, if it's not true that it's no cost because it is being covered by the taxpayer. It's $50 per hour, the normal hourly rate. Because, and I may be wrong on this, my understanding from Beth was that all full-time EMS employees on 24-hour shifts that are full-time automatically get 8 hours of overtime a week. And would this add on to this? What is the penalty if you don't have a threat assessment done? Is it against the law? And what happens? Will the police be called if you have an event and more than 500 people show up and you didn't have a threat assessment done? That information isn't in the resolution. How many times has it been an issue on private property? And just for reference, I know this isn't the same thing. It's a completely different department. But the Tennessee Department of Health standard is 5,000 people for 18 hours or more per TN.gov and does not apply to places of worship. That's the exclusions I'm talking about. From my limited research, it seems as if this could be overreach if it applies to the whole county and not just certain events, and if it applies to private individuals. And anytime you're seeking power and control over a populace, you take on the responsibility for that. So how does this open the county up for lawsuits and liability if we deem it not a big enough threat or something happens and we don't have enough coverage? So those were some of the questions I saw reading it, and that aren't included in the resolution as I could see it. But I'm happy to be corrected on that.
Any other questions from
I wouldn't say it's for the Sunday Festival. I'm trying to determine where we are paying.
No, so if it hits that trigger point, 500 or more, and we're doing that threat assessment, then we feel that that's our responsibility to provide that coverage.
Okay.
We may use an on-duty crew, or I may pay overtime and have somebody come in and cover that event.
If Milky Way sponsors something like the Tough Mudder, that they really, I guess, haven't done since COVID, that's something that would trigger this.
That's something that would trigger, and we
So
don't,
Tough
like, we
Mudder
don't,
also is a private event that
Right.
they pay for EMS coverage.
Which they should, they're
Yeah.
full private event,
Right.
so they would
Yeah.
pay, but Sunday Festival brings all our county citizens into one area.
sure,
We're still providing the same coverage to the same citizens, they're just not spread out through the whole county, they're. in
right, and we
cities.
have an extra unit that's there, and then EMRs, and the no-cost option that's mentioned in there, I can't remember all the questions that were asked, but I do remember that coming up. That's a no-cost option because it's run by the EMRs, so EMRs are providing that coverage. That's through fire rescue. They're not a paid entity, and that's why it's free, is because they're volunteers. So,
And then just to cover the threat assessment part of it, so we sit down with law enforcement, whether it's City of Pulaski, Sheriff's Department, Elton, Minor Hill, whoever it is. So they do the threat assessment. We just basically go, okay, what resources do you need from us?
Is this covering private events on private land?
if
We
we're
haven't-
asked,
Yeah, I mean, we haven't yet that I know of.
Can you come on someone's land and say, this is a threat?
No.
So we're not coming to take anybody's rights away.
Okay.
It's just a, hey, say you have a private event on your property and you have 2,000 people there. Hey, just so you know, there's a threat here, and we would, we're not coming to take over your event. We're not coming to take over anything.
But
We're just.
you'll be coming onto the property
To say there's a threat.
say if there's a threat.
No. How would we even know?
Well, the resolution says private events. It doesn't
says-
say.
Because it says in there that they will assess whether or not
Yeah,
it's
go ahead.
requested
Sure.
or not.
I think that depends on your requesting then.
Yeah.
So you have to ask the EMS to be there, and then if you ask for that on your private event, they'll conduct it.
I appreciate you
Yeah,
clarifying
that-
that, because
it's at
it
your
doesn't
request.
say in that resolution.
It doesn't make it.
It says that they will come on there.
That's your request.
No,
Yeah.
No.
Well, that's the intent, I think,
no,
is what
but
it's.
that needs to be not in there.
We definitely
That
don't
needs
have
to
the
be,
time or
yes.
resources to be trying to
But
figure out
that
who's
needs to
having
be in
private
there,
events.
so it will not be a thing.
Alright, so, no one is gonna be going onto someone's private land, knocking on the door and saying, hey, I heard you had a private event and I'm here to look at your property.
No, a lot of times
That's
it's
not
triggered.
going to
A
happen.
lot of times it's triggered by, a lot of times people have to have insurance for whatever the event is that they're doing. If their insurance requires that they have some kind of medical standby or an ambulance there, then usually they'll reach out to
And
us.
a lot of private events do
Right.
have the large insurance policy
Yeah.
that require some sort of
Yeah.
standby service.
Yeah,
to be
and that's
available.
the intent behind it. Obviously, we have no way of knowing if somebody was having a wedding that they're flying out back or whatever. We don't.
So, we're charging $50 an hour on events where we charge, and we're paying our employees $50 an hour, is that correct? Okay, so that's not a break even, because our employees cost us Social Security, Medicare, health insurance. So if we're gonna pay our employees $50 an hour, we need to either pay our employees $35 an hour, or we need to charge $65 an hour, one of the two. One of those numbers, I would request we would adjust in this resolution. I know EMS is not a money-making proposition, but let's at least break even.
Yeah.
So would we rather charge $65 an hour to the private events, or would you rather pay your employees $35 an hour? And I think that's a rhetorical question. I believe I know the answer to that.
Well, I would say, something in the form of an amendment to the original motion.
Well, I'll make a motion that we charge $70 per hour, which would be in section 2, per person per hour.
Private
Private events.
Got a second to that?
Question.
Not yet. We don't have a second to the. Okay. Second by Gail. Alright. Alright.
What I'm saying is that if we're paying the employee $50 an hour, that employee really cost us more than $50 an hour.
Yeah.
So let's charge private events like Tough Mudder, I keep using, they're a for-profit event, 100% for-profit. And I'm all for-profit, but they can pay for their coverage.
Okay, I understand what you're saying. You shouldn't take a loss on a private event.
Right.
That's essentially what you're saying, and I agree with that. Okay, any questions on just the amendment, not the, resolution as a whole?
On the amendment, if we're charging $70 an hour, but the employee will be into overtime, is that going to cover everything? Because it will be time and a half.
It's not time and a half. It's special event pay is what it is.
So even if they're into overtime on that, it'll just be,
Yeah,
okay.
it's separate.
Thank you for clarifying.
Yes, ma'am.
Any more questions?
How does the amendment read?
Alright. Mr. Wobble?
The amendment would have to read that,
Let's see, you're talking on section 4, correct?
I think I'm really talking section 2 to Stephen.
Okay, go ahead and read out exactly what you'd like it to be spelled out, as, if you don't
When
mind.
standby coverage is required, requested but not required, where's private events?
So, if I may,
Okay.
maybe it would help to differentiate between providing services for not-for-profits and for-profit entities, now that we're talking about it. I
So-
don't know if that,
On section 4, I see where it says EMS staff assigned to special events shall be paid $50 per hour for event coverage. So I didn't know if that was exactly where you were talking about, 'cause you mentioned section 2, but then that also kind of goes into what you were talking about as well. Yes, sir.
Okay, so I would wanna change the ambulance with crew at $200 a day plus $140 per hour
Yes, sir.
would be my change.
So just that alone.
Yes.
Okay. Is
Go
that,
to our minimum.
and then everything else stays
Just
the
change the
same?
100 to 140 in section 2.
Got it, understood. Does that answer your question, Mr. Brown?
It does.
Okay.
No, that, my amendment is to change section 2.
Those clarifying the amendment, adding the specific language to it, okay. Any questions about the amendment specifically?
Is,
Mr.
I'm
Stowe?
looking at section 4 now where it's remaining at $50 an hour.
So we're still gonna pay our employees $50 an hour, but we're gonna charge the event sponsor enough to cover that.
Gotcha, thank you.
Taking other benefits into account, right, and the full math picture.
Or closer to it.
Yeah,
So that's an added section?
You know, we're in section 2, we're gonna strike 100 and change it to 140.
What about the 70 per hour?
Since, well, 70 per hour for two employees, so that equals 140 per hour, is when we're changing that
Okay.
100 to 140.
So it's not a separate section?
just that one number, and that's it. All right, any more questions on just the amendment, and then we'll get back to the original resolution. Okay, all in favor of, changing $100 per hour to $140 per hour, say aye. Aye. Any opposed? Okay, that passes. Now we are back to the original motion, which we do have a, motion and a second for. Any more questions regarding the original resolution, Ms. Jones?
This really should be more specific on section 1 where it says all events, because that sounds like it means all events, which Leah Bailey, referenced. It needs to tamp it down a bit and make sure that the public knows and that anybody that follows this commission knows that it's not every event, such as weddings and so forth, that's was mentioned. So how would you?
What would you suggest?
Well, Leah, you got a suggestion?
Could an amendment be made that it doesn't apply to any private events?
Or maybe you could just say when requested. 'Cause
When
people-
requested.
Unless requested.
Yeah, when requested, this is the pay scale.
Okay. So maybe you add a section or you put it in section 1, but just say it does not, this does not apply to, private events unless requested by
The event
the
holder.
sponsor of the private events. Is that good? That sounds all right?
All right, where would you suggest putting that at?
Right at the end, I say attendees, as requested, shall undergo a further assessment first class.
All events expected 500 or more attendees,
What is it?
As requested,
if requested.
if requested.
Which one?
Can I ask Josh, are you state mandated to do their assessment of 500?
So anything, 500 is our limit, like that's our threshold.
That's a Giles County.
So state is quite a bit higher. I think it's anywhere between 5,000, 5,000 to 6,000 is kind of where the state really looks at for us.
If I could add something, I think it's really important to differentiate between private and public events.
Yeah.
So public events, nobody's really asking for that. Sundrop Festival is a good example. Everybody wants or expects police protection and the EMS coverage available, but there's not usually a formal request. It's just kind of expected. A private event, like they're talking about, is 100%. If they want us, we'll come for a fee. If you don't, we won't, you know? I think it's important to differentiate between private and public.
But when they need you,
We're coming anyway.
When they need you.
Yeah.
they want you there immediately.
Yeah.
So I suggest we do nothing to limit
Mr. Stowe.
I'm trying to make sense of your requested amendment, so see if this works. All publicly organized events or events requested by private citizens expecting 500 or more attendees shall undergo a threat assessment, et cetera, et cetera. So all publicly organized events or events requested by private citizens. We're trying to clarify that, right? The private citizens sometimes request us to be there.
Read that again, please.
Read that again?
Yeah.
All publicly organized events, which is like Sundrop, or events requested by private citizens expecting 500 or more attendees.
Could you put the word private in front of the event? Oh, private
So,
events.
what I was thinking, which may or may not work, but I'm gonna read it to everybody thinks is, all public events expecting 500 or more attendees shall undergo a threat assessment by Giles County Emergency Management, period. Private events may undergo a threat assessment at a citizen's request.
I think, just if I could put a finer point on threat assessment, because
Yeah.
I don't want anybody to get the wrong idea. The threat assessment is not to determine whether or not you can have the event. The threat assessment is just to determine what resources we need. Yeah, it's not approval or denial, it's just what am I gonna need for this? So whether it happens or not really doesn't affect the event, it just lets us know what we need to bring.
Correct. Okay, go ahead.
He wants to put 500 people, and this is the county, and this is the health department or somewhere that says like 5,000. We do not want the 500 people on the private. He's adding in 500 people.
No, the way this reads, ma'am, is that all public events requested by private citizens expecting 500 or more attendees. So that would be if you're gonna have a wedding with 1,000 people and you don't call EMS wanting a truck, nobody's gonna do a threat assessment. But if you say, I'm having an event and I've got 1,000 people, I'm getting insurance, I want EMS there, then we're gonna do a threat assessment to determine what resources we need to provide. So it's at the request of the citizen, or not.
No one is gonna tell you you can or can't have an event on your private property. You have a right to have an event. That is not the goal of this at all. And the reason the number is so low is because we have limited resources in our county. That is why 500 in terms of our county's population and resources would be the equivalent of like 10 or 15,000 in Davidson County, right? It's about the resources that we have. No one's gonna tell you you can't have an event. It has nothing to do with that at all.
What happens if you have a private event and 1,000 people show up and you don't have the threat assessment? Because that's not in here.
Nothing at
Nothing
all.
happens.
If you don't have, this is about resources. It has nothing to do with saying you can or can't have an event. No one's gonna do anything if you have a larger event.
It's a private event.
So can we add that language into this? Because right now,
I just did. You want me to read it again?
Well, no, but why do we have to have the 500? Why do you have that?
Because that's driven by our internal policy, that's where that number came from.
Doesn't matter.
It's just the threshold.
You have to have 500.
And
I think
I
we
think
need
you're
to
giving us a lot more authority than we actually
Okay.
have.
That can be misconstrued.
Point of order. Dr. Laker.
I'm just trying to clarify. Gail, are you proposing an amendment for this? And we're discussing it, but do we have a second?
We don't even have an official motion because there's never any official word
I
to
didn't
put
know
forward.
if Gail was making a motion. We're just discussing.
Correct. Graham, would you like to read your?
Okay. All publicly organized events or public events specifically requested by private citizens expecting 500 or more attendees shall undergo a threat assessment by Giles County Emergency Management to determine the necessary resources to cover that event. If an ambulance is deemed necessary, EMS coverage will be provided at no cost. However, if EMS coverage is requested when not required, the event organizer shall be subject to the established fee schedule.
It makes it sound to me like if you're having a private event now with the rewording that, oh, you're gonna have a threat assessment if you tell us you're having an event. And it also sounds like we're doing it for free unless you're requesting us to have somebody there. sorry, confusion on just the way it sounded to me.
Public events specifically requested by private citizens expecting 500 or more attendees.
You said shall have a threat assessment.
Yeah, those are people that are asking for the ambulance service to be there.
People who reach out for
Okay.
resources. If you set up a 500-person wedding and you don't talk to anybody, you're not gonna get anything, and nobody's
Right.
gonna ask a single question about it.
And that's perfectly fine.
Yeah.
But that should be clear.
It said when requested. If you don't communicate, you're not requesting anything.
Could we add also what, the sheriff said about, just explaining that conducting a threat assessment does not constitute approval or I don't know how you said that.
It doesn't, the threat assessment doesn't, constitute approval or denial of hosting or holding the event. It just lets us know what we need to bring with us, essentially, what to prepare for. And most of the time, there are no known threats, you know.
Yeah, because the way you kind of get to read it and you think, well, is a threat assessment necessary or whatnot
Well,
to get approval?
so
It's
let
like
me-
approval goes along with it, which is what you recognize, which is why you brought that.
Yeah.
Up.
If, say for example, I hate to use this example, but it's an applicable one. If the Klan was gonna have a cross lighting on Rose Hill, and they were gonna have 1,000 members there on somebody's private field, and they didn't ask us, now because of the nature of that organization, we would probably be monitoring it anyway, but just say we wouldn't be standing around, on their farm, but we would be in the public roads, most likely. But if they were to ask for on-site security, that's probably the worst example I could use, but anyway, if they were to ask for on-site security, we would conduct a threat assessment and it would let us know what resources to use. Yeah, non-requirements form.
Mr. Wilbur.
I'll try one more go when you're ready.
You're better Don't stop sticking with this.
Based on their examples, we see what our deputies deal with.
We wouldn't deny their assembly, of course, but we wouldn't be there.
Try a different version and we'll see if this works, okay? All county or municipally organized events expecting 500 or more attendees, or public events specifically requested by private citizens shall undergo a threat assessment by Giles County, et cetera, et cetera. Okay, so we're making a differentiation between county and municipally organized events. That's like Sundrop, it's like
Yeah, thank you.
all kinds of stuff like that. And then we've got the specific, any public event requested by a private citizen. And you know, when you think about it too, like a wedding isn't a public event. We're talking about things where like a demolition derby or a rodeo, where somebody's organizing an event, putting it out on the radio and saying, hey, the public's welcome, we're selling tickets. That's what we're going for.
Mr. Jones.
Kind of, I think it'd be simple, just have it in there. If you're having a private event, I wouldn't even put the number up there, because I could be having one with 200 people, and I could feel like, hey, I could use some assistance. Just if you're having a private event and you request help, then it comes at a cost.
It already says that in section
So
1, I think it clarifies.
I've been all the way around through here for 30 minutes on that same thing, but.
Yeah. Mr. Wilbur.
I'm gonna make a motion to, accept what Grant just read.
Yes, sir.
And also adding to it the last line that is in here, EMS coverage will be provided at no cost, but if coverage is requested and not required, the event organizer shall be subject to established fees.
And that takes care of what Terry mentioned.
Right, so, I'm gonna make a motion to use what Graham wrote, cover the first line and the second line, and from EMS over, we keep that. You follow me on that?
If I could add just one thing, it's gonna be.
Oh, wait 1 second. Let's see if he gets a second, and then I'll come right back to you. Yes, sir.
I'll second.
Okay, go ahead.
So to add to what Grant was saying though, is the threat assessment will be done through Giles County Emergency Management in conjunction with the local law enforcement. So just kinda wanna add that little, we're not doing it, we are doing it with the law enforcement that do, monitor the threats and get all the information, yeah.
Okay. Any questions up here? Well, motion, yes, sir.
We were voting on the amendment, right?
We're voting on the amendment, and then hopefully we will have some final approval after that. Okay, anybody else? Ms. Bailey?
The point I was making with this is not, the main thing that I'm focused on is that we have to write resolutions, and anything that we're passing through here needs to be written the correct way. We can't just say, well, that's not the point, or this isn't, it has to be written in the way that protects the private citizen. And that's all I was asking for. I'm not trying to pass judgment on anything, I'm just saying there are a lot of holes in this that aren't clear. And we really need to only pass things that are really clear and have what is actually covered in it.
Did you read the previous resolution?
What resolution?
The previous resolution, the one that we're trying to replace.
Yeah.
Okay, any more questions on the amendment?
Well, just to build on what Leah said, a lot of times, definition of terms would be really nice in something this technical. Like what is threat
Well,
assessment?
I mean, if you look at this compared to our previous document, this is a lot more specific than our previous document is.
Okay, that's great.
Anyway, okay. Any more questions on the amendment?
Did you make the amendment?
Yes, sir.
Say it one more one, we ready to go.
My amendment is to use what Graham just rewrote, but to keep the last line, that the EMS coverage will be provided no cost, but if coverage requested when not required, the event organizer shall be subject to the fees.
All right, all those in favor of the amendment say aye.
Aye.
Any opposed to the amendment? Okay. Amendment passes. So now we are back to the original resolution. It already has a motion and a second. Anything else on the original resolution itself? All right. Seeing none, all those in favor of passing the resolution say aye. Aye. Any opposed to the resolution? The resolution passes. Graham, would you, send that out just later today whenever you have a chance, please?
Sure will.
Thank you. All right. Now we're going to mental health support services. There are no actionable items on this. There is no actionable items and there is no documents with it. It is just a short discussion about something that may come up in the future. Go ahead.
So I just wanted to see what y'all's thoughts were on having a resource like that, and that would be something that not only could EMS utilize, but so could law enforcement. And there are entities out there that have, whether it's like a mental health nurse practitioner or a counselor, somebody who's certified in kind of acute care when it comes to psychiatric emergencies, that can respond, say if law enforcement is on scene with, somebody having a mental health crisis, whether they're suicidal, homicidal, whatever the case may be, and EMS is en route, this person could also be requested to come out. And then what that does within the system is that person can come to them immediately, do a safety assessment, an evaluation of them as far as their mental health status and all the questions that they ask to determine, whether this person needs to go be inpatient somewhere, or if they just need a safety plan, or they need a resource or whatever, as opposed to law enforcement either, requesting EMS or things devolving into that person going to jail or whatever, which happens sometimes. But, for EMS, we pick up that individual. We don't have the resources to treat them. Neither does the ER, but that's where they end up. And then that person is held for a period of time until they may or may not get placed, or they may leave, or whatever. And so, if that's something that you all would be in support of, I would be happy to look further into that. I just wanted to kind of present it to you first, rather than do a bunch of legwork and bring it to you and not go anywhere.
So it would have to be, so if you're talking about someone actually, you're talking about someone actually reporting in person, not like a
Right.
person or whatever,
And
right?
it could be telehealth, but in person obviously is better.
Yeah. So you'd have to have someone who actually lived fairly
You'd have to
close
have
this
somebody who's
area.
basically on call.
Yeah.
telehealth could be another option, but again,
I guess the question, what would cost be?
and that, I would have to look
I would
into that. I know
assume-
that's the big
I
question,
don't
I'm
know,
sure.
just from my healthcare knowledge, I know that like a psych nurse practitioner, for instance, is the highest paid nurse practitioner there is. So I assume it would probably be fairly expensive. Now, I don't know an exact figure, but just from personal knowledge. Mr. Wallman.
While researching the cost, also research if we can bill Medicare for these services to recoup our costs.
Yeah, and within the entities that do that, they are able to bill because that, and they bill at a higher rate because that's a nurse practitioner. It's a mid-level is what they call it, if you're billing at that mid-level rate as opposed to, so it's almost, it's not billed like an office visit, but it's billed at a higher rate because of the level of provider that's providing the service. But yeah, I can get some actual numbers on that.
That would be the question, is how much reimbursement could we get and how much will we actually be out of
Right.
pocket on them?
Yeah.
So,
Would you clarify, are you talking about a full-time employee or?
No, this would
What are
be
you
like,
talking
like an on-call individual, where if there was something, obviously this person would have to be local, there's a lot of questions that would have to be answered to make this work, but, that person could be on call, maybe it's a group of individuals and they're on call at different times, but if there's an event, they go out and with law enforcement, with EMS, they do an evaluation of that patient.
What does law enforcement do now when you get, cases like, I know you deal with some odd things, so,
So,
what do you do now?
Currently, if we get somebody in crisis or having a psychiatric episode, some of our deputies are trained in crisis intervention, which that's a secondary kind of training that they get, and we're by no means professionals, but it's kind of de-escalation and anyway, if they are suicidal or homicidal, we can take them into custody against their will and take them to the hospital where they're evaluated by mobile crisis, and then that's what she's talking about, placed in the facility. If they're not suicidal or homicidal, like clearly, but they're still in crisis, we gotta walk away.
And so, Willow, you're asking for the same authority, or what do y'all do if somebody's?
So ours is the same way, unless they've clearly said that they're suicidal or homicidal, we can't force them to go to the hospital. So even if they had told somebody on scene, say they had told a family member or bystander, I'm gonna kill myself, we get there and they deny that, we can't force them to go to the hospital, it's against the law,
So how would it be different if you had a mental health professional that you could call on?
because they're trained in the true evaluation of those crises, and they can make that determination.
They have more
based-
authority?
They do have more authority, and they have.
So even if it wasn't plain that they had stated that they were gonna kill themselves, they could still have the person come in
to do an evaluation and
are you
see.
talking about how they have the ability to commit someone and
Yeah.
force them to go
Right,
to
and
the hospital?
like
Is
the
that
psych
what you're
screener
talking
comes
about?
in, like say in the ER, the psych screener will come in, they'll do their evaluation and they determine, does this person need to be, an inpatient, do they need, whatever resource, do they need meds, do they need, what is the next step, and actually point them in the direction of the next step rather than just shuffling them through the system, if that makes sense.
Another thing I would look at is potential cost savings on decreasing repeat calls for people who have the same issues over
Okay.
and over again. That's
Yeah.
hard to do. I guess there's Mr. Wilbur.
That was my question, how you handle it now?
Okay, so you got that then, Shelley?
When you're figuring up your costs, could we do a cost of that versus what all costs we incur right now? We're using the sheriff's department, the police department. You're having to bring in all these people for one situation versus if you could just bring in the one person. How
Sure.
much cost savings we would, because it may end up we save more than we're gonna be spending.
Yeah, and ultimately, and I know, money is the factor that's gonna drive whether this is a success or not, but it's getting the patient what they need in that crisis. And, if you haven't experienced that from a provider standpoint, watching people kind of get shuffled through the system that really is broken, to be honest with you, and not getting what they need, it's really frustrating, and then you're back at their house a week later because they couldn't get their meds, or they couldn't make their appointment, or they're still waiting for a consult, or whatever it is. And you know, there is definitely cost associated with that, but there's also the impact that it has on the individual, so.
Adele?
Yeah, so let's say we have we have a call from a family member and, the person is bipolar, in the middle of a manic phase, totally psychotic, but they don't threaten suicide or homicide. You can't take them in.
Unless they've committed some other kind of crime, like maybe they tore up the house, vandalism or something like that. So, and that's, in jail's really not the answer, that's not where they need to be.
Oh, I know, yeah.
But that's an option. But yeah, it's, so unless the form's called 64, it's a state form, it's a 6401 and a 6404. The 6401 is the one we use for emergency, or request for emergency evaluation. And we can use that, if the person is overtly homicidal or suicidal. But if they're just, and it happens every day, they're in some kind of crisis, but they don't say those key words that we got here, then they just stay there. It's not illegal to be crazy, you know, but they just, sure, I don't mean that.
Well, I'm not in jail.
It's not illegal to have a mental health. But they just stay there, and it's really sad, because, obviously, that's not the way we want anybody to live, you know.
So a position like you're talking about would be, in intermediary?
Pretty much, yeah, it would be, the ability to, so what happens when we take them, if we are able to transport them, we'll take them to the local ER, it's the only place we can go, they'll get evaluated, and then they'll either get, a referral for whatever resource, or they'll get committed and sent to a facility. Sometimes they're waiting for multiple days to get transported or to get placement in those facilities. This would just be, the goal of this would be to expedite that process a little bit and actually get them in front of a provider that has, a specialty in mental health, in whatever crisis they're dealing with, to point them in the right direction rather than shuffling them through the ER and then whatever other.
I'd like to make a motion.
We're gonna, Mr. Walton's gonna make a motion.
I'd like to make a motion to allow Willa to explore this option and bring back to this committee what she finds.
Second by Mr. Brown. All right, all those in favor, say aye.
Aye.
Any opposed? Roger, Terry, y'all wanna say anything real quick before we move along?
Yeah, yes, in a case like this, I have a concern for that person and their family that's around them. But I have a greater concern for the EMS people that are there. We got young professional people that face those things, and I wonder how can you get protection from the sheriff's department in there to protect those people? And can you, at your judgment, call the sheriff's department?
Yeah.
Okay, that's a real critical thing. I mean, EMS is putting themselves out there in very dangerous spots, and they don't have a laser, and they don't have a gun, and they don't have judo training, so these people can really do some damage. They're gonna do some damage to somebody.
And there's plenty of cases, there's plenty of stories about that happening. For us, our internal policy is that anytime it comes out as a psychiatric emergency, if law enforcement dispatch knows, typically law enforcement is already en route, but if we hadn't heard them be en route, we request them, and we just verify that they are on the route. And then if it's a suicidal or homicidal individual, we stage, meaning that we don't go straight to the scene, we wait until law enforcement gets there and lets us know that it's safe, and then we'll go. There are times that we don't have all the information, we might get there and realize that this is not okay, and then the crew will actually just leave and wait for law enforcement. That's obviously not ideal, and it doesn't change the fact that it's still dangerous and things can go wrong, but that is how we try to mitigate it.
I assume we as a county won't pay hazardous duty, but.
Mr. Jones?
I know there's times y'all pull up on the scene and people will refuse service, and that's one part of it. But on this right here, if we do go this route and your person assesses them and sees they don't seem to need to go anywhere, and then minutes later they go on some psychotic, could it ever put us as a county in liability that they were misdiagnosed, or anything such as that that would, put us in any sort of a lawsuit?
That's happening every day, Terry.
Yeah.
No, but
It's,
that's,
it's happening right now.
yeah, but we're talking about if we man this position and then the county misdiagnoses.
So, just to be completely honest with you, it could happen now. If our crew goes out and that person says, I don't want you, I didn't say any of that, I'm good, I'm fine, they won't even allow us to do an assessment on them. We can't touch somebody if they don't let us. And we can't talk to them if they won't answer our questions and talk to us. So, a lot of times we lean on law enforcement to try to help us with that, but they're in the same boat as we are. If they haven't broken any laws or done anything, then we can't force anybody to do anything. And so it's possible we'd leave that scene and something bad would happen.
All right, we're gonna move along. Roger, I will get Willow to get the cost of judo training for the next meeting and one that on the agenda.
They do have classes for like, obviously not to like fight and stuff like that, but just defense tactics. Yeah.
All right, so we have the multi-year contract, we have two. So the first one is the Centos. That, if you look at that, that is just janitorial supplies. So that is no new money. It is using money that is already budgeted for, but this will actually be cheaper. It will roughly save the county roughly $2,000 a year. The reason it has to be approved, even though the money is already there, is because it is an agreement, and then also the money spreads over budget years, correct?
The agreement is a 36-month agreement, so anything that crosses over a budget year has to be approved by the commission, even though we have the funds in our budget for it. But then moving forward, it would be a yearly agreement, the way that I understand it.
And then the Zoll agreement is the 4-year maintenance on the ventilators. The total cost is $2,620. That is the total cost for the 4 years.
4 years.
And then you said that's already in the budget as well, it's just being approved because it's contract.
Because it's over 4 years.
And I would entertain a motion to vote on both at once. Dr. Lathrop, second by Mr. Brown. All those in favor say aye. Aye. All right, any questions, or motion on the, to approve? Motion to approve those amendments. Dr. Lathrop, second on that. Mr. Brown, all right, any questions on either of these contracts? I do not see any. With that, let's move forward with the vote. All those in favor say aye. Aye. Any opposed? And the ayes have it. And then there's nothing on the grant update at the moment, or?
So they sent out an email, it's supposed to announce on the 31st, they sent out an email on the 31st saying that they would announce today. I haven't checked my email, but I can check it here in just a second and let y'all know.
Thank you. Any unfinished business?
And that grant was for how many dollars?
It's approximately $23,000. The actual amount was gonna depend on how many entities within the state requested the monies. And that's an equipment grant. So basically, if you put in for it, you'll get however much whenever they get that sorted out to apply towards the purchase of equipment.
Is that the same pot of money that the rescue squad uses? Because their grant just opened today.
Okay,
Well,
no,
yeah,
it's a different one.
That's
It's a
the
different one.
volunteer
Yeah.
equipment.
And then the other grant, the AFG grant, we're still waiting on. Of course, with the government being shut down, they can't even get on their website, so no idea when or if that'll happen.
So real quick, I wanted to introduce Jeff. I don't think I've actually formally got to introduce him. This is Jeff Driscoll. This is the part-time planner that we hired. I talked about the mitigation plan and during the county full commission meeting. I didn't know if anybody maybe had any questions about it. If so, he's here and would love to answer any questions.
Any questions regarding the hazard mitigation plan?
I'd like to thank some of you for participating in that planning process. Do you mind, sir, if I just
Go
give you,
ahead, yeah.
I'll just give you a brief overview of what it is, where it's at, and where it's going. How's that?
That's okay.
So just real quick, for those of you that maybe did not participate in the process and really doesn't know what this plan is, it's a guide that the county has that helps us formulate. It's a long-term strategic plan. So it's a 5-year plan. So key points to reduce or eliminate risk to life and property from natural, technological, or human-induced type of hazards. Doesn't cover terrorism and things like that. So think of your storms and tornadoes and things like that. Big picture stuff. So there are 5 elements to the planning process, and you say, okay, what's the benefit for us? It's a requirement by the federal government to get federal aid. So your federal grants, you must have a hazard mitigation plans approved both by the state and by FEMA to be eligible for those federal funds. So is it important? Yes, it is. And also, more important than money is the planning piece of it, your input. And I'd like to thank you, Ms. Graham, for all the input that you had. We had a lot of folks that came in and challenged. I like challenges, by the way. I like when people ask questions, because that's what makes us stronger. So these 5 elements: hazard identification at our level, at the county level, and comparing to what we're looking at the state, not national, but let's say Middle Tennessee. What types of threats and vulnerabilities do we have? What does it mean to you as a private property owner, as a business owner, as a resident, our schools? So we'll look at it from holistically from all these different viewpoints, and there's a matrix that's formed so we can identify how we feel about these elements and these types of risks and vulnerabilities. The analysis identifies the who and what. Who and what is at risk, because we have areas that have more vulnerability than others. Low-lying areas obviously impacted by floods. High-density areas and traffic obviously more impacted by maybe hazardous material, for example, because it's condensed, chance of an accident is greater. The strategic planning part, that's where we come in, where we went through our plan. It takes about 18 months. We did it in 6. And I'll tell you about the timeline. So we think we're okay at the state level. We're waiting on the government to wake up and go back to work is basically what we're doing. So we identify the risks and suggestions. So are there any policy changes? I'll give you an example. Your special events plan that you're talking about, this process and resolution, that's part of mitigation, because you're trying to identify in advance the potential for a hazard and the outcome, and you're trying to mitigate it. So that's a real good example of mitigation efforts, because you can save lives, property, and money by planning together, doing exactly what you folks are doing. So I applaud you for that. I really was enjoying this conversation. It was very important. Education, changing building codes, for example. Those are just types of actions you can take to make a more resilient, stronger community. Implementation, those are those long-term actions. Flood control, building safe spaces, putting in sirens and alerts to alert vulnerable populations so when something does happen. And finally, the 5th piece is that pre- and post-disaster actions. That's that ongoing cycle as something does happen. You come back and go, what did we miss, or how we could get better? And you may have, I look at them as opportunities, because sometimes you have short windows with the state or with the federal government to get money to mitigate something, for example. So those are good opportunities. And, a lot of times people get frightened by mitigation. You go, what is it? It's just simply taking an action to offset the vulnerability and the consequence. It's the rare time that we have ahead of something that we can anticipate, well, what could we do? What, if anything, could we do? And you set those priorities. And we live within our means, and we buy what we can buy, and we build what we can build. But that 5-year plan is a pretty solid plan. We submitted it to FEMA on September 24th. We got their letter of approval that goes to FEMA, so that piece is done. They were happy with our plan at the state level. It's been sent over to FEMA. Their drop dead date was November the 30th. They got 45 days to review our plan, kick it back for any revisions or suggestions. We make that, resubmit it. Unfortunately, October 1st, the government shut down. So what does that mean to us? The clock will probably reset, but I've seen this before. I've experienced the exact same thing before with hazard mitigation. What happens when the government opened up, they are piled up with work. And they are driven to try to get these easy, low-hanging fruit projects out the door and done with. And our plan is really good. And that's why I say I thank each and every one of you. And in the future, I ask for your support. So when Josh mentions something, it's important. And me, if you see me come to you and want to talk to you, I don't believe in talking just for talking. I believe in coming to you if I think something's really important that you need to know, and I need your help to make it happen. So any questions about the hazard mitigation plan, what it is, where we're at? Okay. At any time, I'm open and available. It's a draft plan right now. Will be available to you, so I'll have it available to you.
In Jones County, what do you think the most likely hazards that you could say are?
Oh, it's pretty, you can answer your own question. Give me the top 3 that would keep you up at night.
Water.
Okay, that's a big one. Tornadoes, especially since we've seen this trend of it, the paths that they're taking coming across Mississippi, Alabama, highly predictable, will reoccur, and they seem to be getting stronger and more frequent. Storms in general are the number 1. So winter storms, summer storms that bring water and high winds. So with that comes the 3rd piece of it, that's flooding. That's the one that we will see reoccurring. That's a good mitigation project. That's a very good question. Thank you. Any more questions?
Anybody else?
Thank you, and it's a very nice meeting those of you who haven't had a chance to.
Thank you. Any unfinished business? Any new business? Mr. Reed.
Yes. Doesn't have to do with this very much, but on the website there, CTAS has training for running effective and efficient meetings. And we all can sign up for it, and we all need it. So please look at that and let's sign up for it.
Motion to adjourn. Anybody want to second his motion to adjourn? All right, that's you too.